Hello, in today's video, we'll be speaking about a very common condition called endometriosis. In endometriosis, the tissue which lines uterus starts growing elsewhere, that is around fallopian tubes, intestine and ovaries. The international guidelines recommend surgical and medical treatment as first line of treatment for endometriosis. But it is worth noting that around 20 to 40% of women still have symptoms after treatment. The latest guidelines of pain sciences tell us that it is important to use biopsychosocial model for treating chronic pain condition like endometriosis. It is very important to understand the cause of pain rather than just to focus on end organ treatment.
So as you can see here, I've shown the different pathways which carry the signals to the brain. This is the efferent pathway from the pelvic floor muscles, and this is the efferent pathway from the bowel, bladder, uterus. This is the visceral group and this is a somatic system. Okay, so the signals, the pain signals which are coming from bowel and bladder and which are coming from pelvic floor, it's difficult to say from exactly where the pain signals are coming because the pathway has converged, because the efferent system converges when they go to the brain, because they have a same pathway, pain pathway. Okay, so this is one thing. So what happens is, in case of endometriosis, there is pain which is coming from the intestines or the visceral system, and it is coming for a long time, for years it has been coming, but sometimes it is interpreted that it is coming from here, and because of this muscles can undergo spasm, and because of the close proximity of the visceral structures to the pelvic floor muscles, there can be myalgia or myofascial pain syndrome. Myofascial, which is nothing but muscle spasm or muscle tightness, which may be causing pain. But because every time there is a pain or there is a recurrent pain, the focus is on the visceral system, the pelvic floor muscles and the somatic structure system never gets the treatment, and this further exacerbates the spasm or the tension or tightness in the pelvic floor. Okay, so it is very important to treat pelvic floor muscle in case of chronic pelvic pain, because many a times the pain may be coming from the pelvic floor, okay, and it may be mimicking the pain. So as in the pain may feel like it's coming from the visceral structures, but the pain is coming from the somatic structures, and the treatment is constantly given to the visceral system, and this system is never really given any focus. So it's very important to focus on reduce the focus on the end organ, and treat the pain as such. So and make sure what is the cause of pain and then treat it accordingly. So in physiotherapy, we give treatment to the pelvic floor structures. The treatment could vary depending upon the cause of the pain. Also, secondly, the alarm system. So the area of the brain which corresponds to this part, that is the bowel, bladder, uterus and the pelvic floor. In that area, the alarm system, the threshold is set really low, because the pain has been traveling for such a long time that even a small stimulus is enough to set the alarm system on. So it becomes very hyper sensitive, and even a small stimulus can set the alarm system. So the pain has inherent mechanism to inhibit pain, which is again suppressed, rather than the pain signals are amplified, because of the pain has been coming for such a long time now. So even a small non-noxious or non-painful stimulus also can be interpreted as painful stimulus. Sometimes the loop is so well formed that the signal doesn't even have to travel at the brain. The decision is taken at spinal cord itself, and it causes spasm of the pelvic floor muscles. biopsychosocial approach is very important in treatment of chronic pelvic pain or doing justice to the pain management for the patient. We have already discussed about the biological approach. Now the psychological approach, we mean we have to consider the beliefs, thoughts, emotions of the patient. This can only be done if we take proper history, if we listen to the patient. Sometimes the various thoughts, beliefs also can act as trigger to their pain or trigger to their symptoms. So identifying those and also making the patient understand the importance of thinking right, having a right lifestyle also is very important. And social factors like various environmental factors, diet of the patient, the family members whom the patient is living with, anything. So these are the factors which may be trigger of for the pain. So understanding this and making the patient understand is very important. So seeing the patient as a whole and treating pain of the patient rather than only having end organ focus is very important. I really hope this was a helpful video. If you know any patient who is suffering from endometriosis, or if you are suffering from endometriosis and have any other questions, please you can write down in the comment section. I'll be very happy to answer it. Thank you.